Good afternoon, YouTube. Anthony Darby with Peninsula Wellness, Peninsula Alternative Health here for a weekly lunch and learn. I guess we should quickly apologize for last week. We got a couple different balls in the air. Last week we had a couple podcasts run long. I appreciate Donnie Waters coming and joining us. We got into the weeds on life and philosophy and talking all kinds of good things and ran a little bit long. So if you guys were tuning in last week, I do apologize, but we're back on time and informed today. And the topic of discussion today is why dosing matters. I'm going to talk all about dosing. Um, it's a very pertinent topic to talk about because I would argue that out of everything that we do at the dispensary, the challenges at this point with a mature program, us having lots of product offerings, having different types of products, still getting that dosing dialed in is the number one challenge. And I think that if you talk to clinical directors across the state and the country, they would all echo the same sentiment. Um, there's a fancy word called a biphasic effect that is descriptive of how cannabis works, and what that means is that they're finding a sweet spot to a cannabis regimen is really the crux of success. So if a patient is not using enough, they're likely not going to get the desired outcomes that they're looking for. They're likely not going to have success. And at the same time, if a patient's using too much, it's the same thing. They're not going to have the desired outcomes they're looking for. It's not going to be successful. So I would argue that our team and what we do so well is really helping patients go through that journey of dialing in their dosing. And that's not just on the THC side of things as well. We find this very often with CBD. I would argue that the number one reason why people claim that CBD did not work for them was because their dosing was off. Either they were very sporadic in their dosing, they were taking it maybe 1 or 2 days a week instead of taking it every day. Maybe they bought a vape pen from the gas station and they thought that they could just use it kind of as needed. That's not really how CBD works. So it's important to understand how you're dosing your medicine to make sure that you're getting the most out of your medicine. And for those folks that are concerned about money and the cost associated with the medical cannabis program, really understanding your dosing, managing your tolerance levels, and putting together a minimum effective dosing plan or a microdosing plan is really a way that you can make sure that you're medicating not just in the best way possible to get the health outcome, but more importantly, in some cases, also managing your financial dollar. So I've talked a little bit about how there's a sweet spot, but I think it's important to understand, what the goal here is when patients come into us. So whether it's CBD, THC, CBN, CBG, what other cannabinoid and terpenes we're utilizing to try to create a health outcome, our team is classically trained in microdosing and in creating the minimal effective dosage. And what that means is that we're going to try to always go slow and low with our patients. We're always going to try and start with the smallest amount of cannabinoids that we believe will create that health outcome, and then we'll titrate up or we'll add to that program as we see how the patient's going to tolerate it. I think microdosing is something that if you're listening to this podcast, but you're not coming to our dispensary, maybe you're out of state, or maybe going to another dispensary, it's really important that you want to cue that patient consultant or the whoever's taking care of you that, look, I am a new patient, I am THC naive, and microdosing is something that's important to me because I don't want to walk out of here with products that are going to make me feel completely stoned, lethargic, may create higher levels of anxiety. All the negatives that happen when people overdose on cannabis. No one ever dies. That's the great news. But the bad news is that a lot of people have really poor experiences, and a lot of people can be disheartened in the optimism of cannabis affecting them in a positive way because they use too much or they use too little. So use that word microdosing when you walk into a dispensary, and that cues up whoever's taking care of you that you're really trying to manage your THC levels to make sure that you're getting those outcomes, but you're not also just blowing your tolerance. I think it's important to understand that for newer patients that come in and they start seeking these very high THC products, we see this happen. We will actually see their bodies start to adjust and adapt to the products that they're taking. And very quickly, they're taking more and more and more. And to get the same exact effect, they're spending more money and using a lot more product. So for those folks that appreciate that feeling that they get from cannabis, as many of us do, there's preservation in trying to make sure that you don't blow your tolerance, to make sure you're ensuring that you're getting that same feeling every time that you use. So obviously, getting the dosing is important, but I would argue that understanding how the dosing based upon the type of product that you're using is really important as well, and then understanding why the why. We try to talk about the why a lot. So I'll start with dosing inhalation products, smokable products. So if you are new to cannabis, and you have pretty much ignored the advice of our PCs to try something like an edible or something that's easier to dose, and you want to start with inhalation, we're happy to help. Understand that of all the ways of administering products, inhalation probably gives you the largest room for error when you are using it, because it's tougher to measure drags of a vape pen or bong hits or whatever other method of administration you're using to inhale cannabis. So it becomes challenges with the exact amount that you are using each time. The benefits of dosing with the inhalation product, like a vape pen or flower, is the fact that the onset time is much quicker and the patient quickly understands whether or not what they've used is going to be enough or not in a quick way, and the ability to adjust based upon that is a benefit as well. So at the highest level, if you're asking yourself, well, from a dosing standpoint, why would I use an inhalation product or smoke versus eat an edible? From the dosing standpoint, if you need to make a dosing change, it's much easier to adjust with with a smoking product, because once you take a hit off that vape pen, within 10 to 20 minutes, 30 minutes, you're going to have a real good understanding of how it's going to affect you. And if you need more, you can take more. And if you took too much, the good news is that you'll typically see those effects start to wane down after another 30 to 60 minutes. The adverse, or the opposite of that, would be an edible product. When you're dosing edibles, the reason why it's so important that you start slow and low is because the onset time of an edible is much longer and to kick in, and then also the duration of how that product is going to affect you is much longer as well. So when you take an edible, let's say it's a soft lozenger or a troche or a gummy, whatever they're called in your state, um, especially if, and understand cannabis is fat soluble. So if you take that edible and you don't have any fat in your system, and you just take that and it just sits there, it could take up to 2 hours before you really start to see those effects from what you've done. So if you are impatient or you are in pain and you take an edible and you say, okay, it's been 30 minutes and I don't feel anything, and then you take another edible, and this is a story that you hear over and over and over again. By the time that first one kicks in, it's enough, and now the second one kicks in, and now it becomes too much. And the duration of an edible product is going to be much longer than the 1 to 2 hours that you could expect from smoking. Onset times for ingested products could be as long as 8 hours, which really puts a person in a situation. So if you have taken too much and it's an edible, that means that likely you still have several hours of uncomfortableness and several hours of displeasure to deal with, which is all the more reason why you really, really, really want to start low and make sure you're microdosing and titrating up. Um, Typically, when folks use inhalated products to dosing, if it's a vape pen, then we're typically talking about a single drag, typically 2 to 4 seconds, very small, and then waiting at least 15 to 20 minutes before you would do anything else to get an idea of how that's gonna work. The same could be said with a joint or or any other type of method that you want to consume flower. Typically one drag at a small capacity, and then waiting 15 to 20 minutes is going to give you an idea of how your body is going to act to that cannabis. When it comes to dosing ingested products, we would really strongly recommend starting for first timers that are looking to microdose. You're going to want to keep your dosing and to I'd say 1 to 2.5 milligrams. And that is going to prevent you from having that intoxicated feeling. So we typically talk about intoxication or psychoactivity happening at about 2.5 milligrams of consumption. So if you're starting with that 2.5 milligrams, is a good way to start from a microdosing perspective with an edible. And it's likely that if you're a first time consumer or you are truly microdosing and you're using other cannabinoids like CBD, you may get the desired outcome that you're looking for with that small dose. it is likely, if you're looking for stronger symptom relief, if you have stronger levels of pain, stress, and anxiety, you're probably going to need to be in the sweet spot of around 2.5 milligrams to 15 milligrams. That's more consistent with what we see with our patients that are daily users, our patients that are using cannabis more often. We find that that's a real good sweet spot to keep your tolerance low, to still be able to add on additional products on top of that. So if you're using an edible, let's say for kind of your daily driver, and let's say you're going to start with a 10 milligram lozenger, and maybe you break that into twice a day. So 5 milligrams in the morning and 5 milligrams at night. But you find that maybe during the day, because of some circumstance that you find that you peak around lunchtime. Well, if you keep your tolerance low and you're only using an edible of around 5 milligrams in the morning and night, that really does allow you then to add in something like a vape pen for as needed PRN. If you are having pain breakthrough, or you are having an anxiety breakthrough, to be able to have like a 1-to-1 CBD THC pen, something somewhere like the Heal collection from Rhythm, is a great option to be able to combine a couple different things. So if you think about that regimen that I just lined up, so let's say that you have stress and you're looking to implement a THC protocol and a CBD protocol. So let's say maybe you would start with one dropper full or 30 milligrams of our Peninsula Holistics CBD as your kind of your daily driver for your baseline. And then for your THC baseline, let's say you take 2 5 milligram lozengers throughout the day. And then you would then implement a vape pen for the breakthrough. So the CBD and the THC are really providing you that round the clock, that much longer extended relief. If you think about an extended relief option, because it's going to take longer to kick in, and then it's going to stay in your system a lot longer. And then you're able to use the vape pen for that quick onset time, that immediate need. It really is it's a great example of how someone can properly dose themselves, keep their tolerance low, control breakthrough and onset where you would need quick relief, try to create a more stable long-term treatment plan as using CBD and THC in a more regimented way every day. And what we find is that utilizing multiple products in a way that's going to balance the needs of your short-term needs and then your long-term goals is really how we start creating these effective dosing plans. Talking about dosing with topicals, topicals are, once again, they're a little harder to dose than something like an edible or RSO, or something that's coming in a measured form. A tincture comes with a granulated dropper. It's very easy to measure. When you get into topicals and you're just kind of sticking your hand and you're rubbing on, the dosing is a little less accurate. The great news is that the need for accurate dosing subsides a little bit with topicals. So whether you put 10 or 15 milligrams of topicals on, even if it's a THC product, the likelihood that your body understands the difference of that is fairly unlikely. Now, obviously, huge differences between using 50 milligrams or 5 milligrams for these products that break the blood-brain barrier. You could notice the effects. But for topicals, it's really about understanding, from a quantity standpoint, how much you need, depending on whether it's an actual topical issue, whether you're trying to treat something like eczema, not treat, but if you're trying to help eczema and it's actually like a skin issue, or if it's more something like chronic back pain where you want to put a topical on in the localized area to get that localized relief. How we can really help as patients are going through this dosing journey. I think it's important to understand that a lot of our patients go through lots and lots of dosing changes as their journey continues, and as we have new products to market, they understand. And I really believe that, especially from a CBD perspective and THC, our patient services team with Donnie Jackson and Dr. Hoffman are really more suited than most to be able to help patients navigate through this journey. And what we can do when we interact with patients through patient services is not only can we save a lot of the unnecessary dosing changes and maybe some of the negative side effects that you would get from underdosing or overdosing cannabis products. We can help save a lot of that, but we can also be way more cost effective in getting you to your end goal. So instead of having to go out on your own and try a lot of this trial and error, because of the amount of patients that we've helped, and because of our knowledge base, we can look at and understand your situation and apply our best practices to get you to that desired health outcome a lot faster. And that's what we get really excited about with patient services is when these new patients come in, and typically it maybe took us 2 months to get them dialed in and get their dosing right. Now we're seeing that we're able to do that a lot faster as we're collecting more patient data and getting a better understanding of really what makes our patients have progress and success, and being able to apply them throughout the process. So the dosing is super important, and I would argue that if you're a new patient and you're not using a dosing guide, and you're not journaling, and you're not tracking your dosing, then you're really doing yourself a disservice. By far, the number one way that I know that we can help patients is when they do a really great job of journaling and tracking their dosing, bringing that information to us and allowing us to see it firsthand, letting us pick up the patterns and trends that we see based upon that information, and then apply some useful tips. So that's we're gonna keep these short. That was 15 minutes of good dosing knowledge. If you know someone that's about to start their cannabis journey, or you are on your cannabis journey as well, please keep the focus around dosing, keep the focus around what products are helping you out, and really try to create the best regimen for yourself to continue to create these health outcomes, so that cannabis can be used as a long-term tool in your wellness path. So thank you very much, Anthony Daugherty, Peninsula Wellness, Peninsula MD, Wellness/Peninsula MD. If you want more information about our tinctures or our products that we have to offer, stay tuned next week. Thanks a lot. Have a great day. Don't forget to like, share, and comment on our post.